Hi, I'm Dr. Amy Myers. I'm the New York Times bestselling author of both The Autoimmune Solution and The Thyroid Connection. I'm also the medical director of Austin Ultra Health. And I am excited to announce today that we have finally released my new multivitamin called the Myers Way Multi. Now, this multivitamin, if you've heard me speak before, you know that I recommend that everybody, children, mothers, fathers, brothers, sisters, everybody should take a good, high-quality multivitamin this day and age, given what we've done to our soil and our food supply. And I've specially formulated this multivitamin to be a companion multivitamin to go along with my book, The Thyroid Connection. Now, you don't need to have a thyroid dysfunction in order to take this multi. It's there just as a general overall good health multivitamin. It's also there to help you prevent from getting any thyroid dysfunction. And certainly it was formulated for those of you who already have a diagnosis of either hypothyroidism, hyperthyroidism, Graves' disease, Hashimoto's, thyroid cysts, thyroid cancer, and thyroid nodules. And of course, all those people who've been told that their labs are normal, but they still have thyroid symptoms. So this multi is for you. The great thing about this multi is that it comes in capsules as compared to before our multi was in a kind of a hard shell multi. And so this is really great. If you want, you can open it up and break it into your smoothies or even just drop it right in and it will break apart. Or of course, it's super easy to swallow. So what is so great about this multi? Well, again, I formulated it with those with thyroid dysfunction in mind. It has lots of vitamin A in the form of both vitamin A and then mixed carotenoids or beta carotene. And we need that for us to get the T3, which is the most important active form of our thyroid, into our cells. We have lots of B vitamins in there, and they are pre-methylated B vitamins. So if you're somebody who has mutations at MTHFR, if you've heard me talk about that, you want to make sure your multi always has pre-methylated B vitamins in it, like folate or 5-methotetrahydrofolate. I know that's a big word, but it's the active form rather than the synthetic form of folic acid. And I have 800 micrograms. We also have B12 or methylcobalamin in the pre-activated form of 1,000 micrograms or 1 milligram. We have vitamin C in there. Oh, let me back up and tell you those B vitamins are really good for the thyroid to make the thyroid hormone as well as to support our adrenal glands. Many people with thyroid dysfunction have adrenal dysfunction as well. The vitamin C, I have 1,000 milligrams or 1 gram in it. And that's really to help us get that iodine, one of the key nutrients we need to make our thyroid, into our thyroid tissue and into the cells, as well as it helps support the immune system. So anybody who has autoimmunity. We have vitamin D in there, which is 1,000 IUs or international units. And it comes with vitamin K so that you're not getting calcium buildup. And of course, we need the vitamin D because it helps prevent with thyroid cancer and thyroid nodules. There's some studies out there showing people with decreased vitamin D levels have more incidence of autoimmunity, thyroid cancer, and thyroid nodules. So we want to make sure we're getting a good amount of vitamin D to protect our immune system and to have a healthy thyroid as well. And then we have our key ingredient, which is iodine. And this is something that I don't see in many multivitamins. And if I do see it, often it's in very low dosages. So I recommend in my book between 150 and 300 micrograms of iodine. And I have 300 micrograms in the multi that I've formulated, the Myers Way multi for you. And of course, we need iodine. It's the key component in order for us to make our thyroid hormone. So it's not one you want to skimp on. We have some magnesium in there to help with bolster our glutathione and our protect our adrenals and to help us with our immune system and make glutathione. And most importantly, this is another thing that I find many multis, including the one that I used to carry, did not have enough selenium. And besides iodine, selenium is the most key component that we need for our thyroid. In fact, many studies show, there was a German study that I write about in the book that showed that those people with low selenium levels had a much higher incidence of Hashimoto's. And by simply taking 200 micrograms of selenium a day over 3 months, the report or the study showed that there was a 66.4% decrease in TPO antibodies. And even in many of those people, their antibodies completely went negative. So if you have Hashimoto's or any form of thyroid autoimmunity, you definitely want to make sure you're getting 200 micrograms of selenium. And that's something that I haven't seen in any other multi. So that's why I created this special multi just for you. We also have zinc in there, which is of course important for us to make our thyroid hormone and TSH. So there's many, many other components, but those are the key ones to support everybody who has either autoimmune dysfunction or thyroid dysfunction, to help support them. And again, this multi, and I'll show it to you here, we have the multi, the Myers Way multi, and we have it with and without iron. So if you're somebody who has low ferritin levels or low iron levels, then you'll want to make sure you're taking the one with iron. If you don't and your iron levels are good, you can stick with just the general multi. And again, this is for anybody who just wants good health, anybody who wants to prevent autoimmunity or thyroid dysfunction, and of course, all of those people who've already been diagnosed with some sort of thyroid dysfunction. That would be hypothyroidism, hyperthyroidism, Graves, Hashimoto's, thyroid nodules, thyroid cysts, thyroid cancer, and anybody post-thyroidectomy like myself. So how do you take this multi? Well, it comes in 6 pills. I know it sounds like a lot, but again, they're capsules and they're easy to swallow. And you can even put them in your smoothies if you want. And what I recommend that you do is that you take 3 at lunch and 3 at dinner. You can, of course, take them at breakfast, but those of you who are on some sort of supplemental thyroid hormone, there is a little bit of calcium in here that could possibly interfere with your thyroid hormone. Not a problem if you really need to take it at breakfast. It's not as, a lot that it shouldn't interfere, but just to be on the safe side, if you want to take it at lunch and dinner, best with food, because we do have some fat-soluble vitamins in there, which are better absorbed with food. All right, so I'm excited about the new multi. I'm thrilled that I was able to get this, as a companion for the thyroid connection. And so pick up a bottle today. Thanks.